Hello there, my name is Corey Durbin, CEO of Shared Health Alliance, and I'd like to welcome you to Running Eyes, a podcast where we take a meaningful, deep dive into the relationships, strategies, and global mission of ASH to change healthcare and change lives. I am joined by my good friend and the president of Alliance for Shared Health, Mike Hinchus. Mike, it is great to be with you today. It's a lot of fun to sit down and get to have these conversations, and I think it's important to gauge and share with our listeners kind of how we have formed our relationship through the years. And we're starting to get a little long in the tooth. You know, we're going back now to college in 1992, where we were both playing college football at Northeast Missouri State, huh? It's almost 28 years.
Yeah, it doesn't seem possible. It does kind of seem like another life when people start talking about football days.
Yeah, so we went through that time in life together, and you eventually transferred down to the University of Missouri and got a degree in horticulture, turf management.
Yeah.
And started your own irrigation company eventually, and went into the business world, and I went into kind of the employee benefits world, and we stayed in contact and remained good friends through all that time and kept up with each other. And eventually you sold your business and went to work for Columbia Land Care?
That's correct. After leaving Northeast Missouri State, like you said, they didn't have the program that or the degree I was needing to pursue my goal into what I wanted to get into was the golf course world. Went to Mizzou, got a degree in plant science. After 6 years as an assistant superintendent, I started my own business. And after 10 years of running that, merged in with Columbia Land Care in Columbia, Missouri, which is a commercial turf and grounds provider for businesses there in the Columbia area.
And so about the time you had sold your company, there was a time where I had sold my first employee benefits firm. And after about 3 years of working for the company that bought us, I went back on my own and went into a health share program. And then we started to develop programs that would help members in health share programs have access to more things that aren't shared by health share programs. And so eventually I was one of the initial founders of Alliance for Shared Health, but back in at the end of 2018, when it really started to take off, I realized I needed to recuse myself from from running Alliance for Shared Health and make sure there was a proper arm's length from me in that organization. And I gave you a call and I said, Mike, what I knew is you had started your own nonprofit called St. Raymond's Society, and that was one of the things I'm like, man, I wonder if this would be something Mike would be interested in. Maybe you could talk a little bit about your background with St. Raymond's and sort of how that came to be.
Sure. Kind of running parallel to my career, Columbia Land Care was this time spent developing an organization called St. Raymond's Society, and this is truly definitely a situation where you don't choose a calling in life, but it chooses you. I had this thought that would not leave my head for better than 8 years, and then I realized it's not going anywhere. I better do something. I'm supposed to do something with it. Didn't really feel qualified, didn't really have the time, but thought maybe I should do something.
And what year was that founded?
That we began in 2010.
Okay.
Right before I sold my company and started working with Columbia Land Care. So in that organization, primarily we help single moms get on their feet. In visiting with a friend about it who was very supportive and helped get it going, we realized that there was a void in the support for a mother who is facing an unplanned pregnancy. We could see the support that was there during her pregnancy, but after the child was born, we thought that there was a little lack of support. So that's why St. Raymond's came into existence, to support specifically in that area. And again, I just thought we'd get something started and it would fizzle, and at least I could say I tried something. But the community support rallied around us. Pregnancy help centers were referring mothers to us, and lives were being transformed. So it really opened my eyes as to how enjoyable that was to work and give forth effort and let God bless it and do amazing things in people's lives.
Yeah, and I think what you have done there and how that has grown that was impactful to me in thinking about how are we going to actually have this organization that has a chance to change healthcare and change lives, where somebody who really knows how to and has experience running a nonprofit can also sense what our heartbeat and what our vision is for this thing. And so I guess it was January of 2019 when you took the reins and started to bring on board members to really run and work with you on the decision making. And it was February of 2020 that you and I went over to Ethiopia with the board of Alliance for Shared Health. And maybe my question is, how did that trip impact the day-to-day running of, or how you see this organization?
That was a really clarifying moment for me, that trip to Ethiopia, because when you asked me to consider taking the reins of Alliance for Shared Health, it seemed like the next logical step in my life that God was preparing me for, with the experience I had in the corporate world, with the experience I had in the nonprofit world, and this idea of ASH and what we'd be able to do to help members here in the United States, as well as have a significant impact with our predecessor relationship, this group in Ethiopia, that we're able to impact lives over there as well too. I didn't really understand it. I knew we were helping people over there, but I didn't really understand it until we took that trip over there, and I could see firsthand the human need, the human suffering that was that we saw over there. It's hard to describe, but leaving that trip, my purpose with ASH was solidified in growing this organization so that we can help more people over there who are just struggling to live.
Yeah, one of the most impactful things for me, the impression really set in, was on our flight back. And we had flown back from Ethiopia, from Addis into Dublin, and then when we landed in D.C., to fly to our respective home cities, I got on that flight and I just remember, I think I cried all the way from DC to Denver and from Denver back up to Portland when I landed. And, it was very eye-opening for sure. And it's one of those things that it's hard to convey to the listeners, to those that are involved with Alliance for Shared Health, that we realize there's a purpose that's bigger than just us. And when there's tough stuff that happens, when there's regulators saying, yeah, how does health share work and who are you guys? And I think we both remember that trip, and every board member remembers that trip and says, we need to have an impact on people in the U.S. And we also know how much those people in Ethiopia need us to be have an impact on our members here.
The moment for me that I guess brought tears to the eyes is when we were in the pediatric hospital. I think it was on our first day when we ventured away from the capital city there, and we got into more of the remote areas, and we went into this pediatric center, and this room is full of children that are suffering malnutrition, and on the verge of death if they're not in that hospital getting the care that they need. And going up to this little boy who I understood was 2 years of age but didn't look much more than a year, holding his hand and just recognizing that this is my son. I have been blessed with 4 children that we're at home and safe and healthy, but I'm looking at this boy in desperate need and struggling for his own life, and I'm like, this is my son too. And that moment right there just really struck me, and the tears started flowing, and I realized, when we come up against obstacles here with Alliance for Shared Health, I got a little picture of that boy named Joseph on my desk, and he pushes me through every day.
I love that. Now, if we fast forward now, we've gone through quite a number of months of COVID, and you work daily with the staff of Alliance for Shared Health and the customer service team. And what's it like when you see what their heart is for our members? And I don't know, can you just talk a little bit about the impact of working with the team is?
The staff that we have is second to none. I've worked with a lot of teams in the past, again, both in the profit world and the nonprofit world, and the staff that we have here is just remarkable. The hearts that they have for our members and wanting to do things the right way, it's just really refreshing and inspiring. And I've been used to being in groups where I have to be the inspiration to motivate people, and this staff is that for me. They motivate. They're already positive. They're already motivated. They have huge hearts to help people. So it's very refreshing to be around. It's though our core values live in them without us having to pound them into them. They are truly remarkable.
I am appreciative of you sharing that. I think where you and I have gone from the number of years we've known each other to where we are today, and you go back to football days, and I was a quarterback, not a very good one, and you were a fantastic all-state high school wide receiver, and probably your college career, you'd say, was less than what you would have planned as well. And now it's more like we get to quarterback two different organizations, and we just want we kind of get ourselves out of the way at the end of the day.
Yeah, I think that we shared a common position at Northeast as being the holder for extra points and field goals. That's what was about our only action on the field.
That's probably true, yeah.
When we left there, I did not really foresee a time in the future where we would reconnect like this, but I'm super glad that we have. As the purpose here with Ash, it seems to be I'm in the right spot.
Thank you for what you're doing for Ash, and we're definitely driven to have an impact here and certainly all over the world. And we're on our way. I think we're on the right track, and your leadership and leading Ash and sharing with our staff the heart of where this thing is going, I believe, is impacting them, and it's reflecting in what the members of Ash see every day too. So thank you for that.
Well, it's truly an honor to be able to serve in this role.
It's great to sit back down with you, and hopefully we'll get a chance to do this again sometime.
I hope so. Thank you very much for having me today.
I think it's really important that the agents for Shared Health Alliance, that our members, and I mean the members of ASH, get a chance to hear from Mike Hentges. He's somebody I really admire. He's somebody who is extremely loyal. And when he took over at ASH, he took over in the middle of knowing that he was jumping into a situation that there are a lot of challenges in the health share space. And he's really met those challenges boldly. He is very well equipped to handle the things that come at health share ministry programs. And it's great to have somebody that I know isn't going to run when challenges come at us. And I'm really grateful for him. He's been a friend to me no matter what's gone on in my life. And I know the impact that he's going to have for Alliance for Shared Health as it continues to grow is going to be felt for a long time. So such a great time to be with Mike. And anyway, it's hopefully I get a chance to have Mike on again and share more about who he is. And I know he is moved extremely deeply by what happened and what we saw over in Ethiopia. And I know when some of the regulatory pressures that health share ministries face come at him, the time that he spent over in Ethiopia and the time he spends connecting with Pat Bradley definitely helps spur him. So great time with Mike. Thanks for listening today.